Hi, this is Jamie Michelle, the founder and president of Gays Against Groomers. I'm so excited to let you know that our organization just launched our first book. That's right, Gays Against Groomers now has a book. It's called The Gender Trap, The Trans Agenda's War Against Children, and it is the book the radical gender mob does not want you to read. If you are a parent whose son or daughter is questioning their identity, if you are puzzled by how the radical transgender movement has penetrated every area of life, if you feel abandoned by an ideology that distorts everything you always knew to be objectively true, if you have ever been ostracized simply for pointing out the obvious, or if you just want to know what on earth is going on, this book is for you. Head to thegendertrap.com to get yourself a copy today. I promise you're not going to want to miss this. And if you'd like to support Gays Against Groomers and the work we do to end the war on children, please head to gaysagainstgroomers.com for ways to donate, get our official merchandise, or even join the team. Thank you so much for your support and enjoy the episode.
Welcome to the dark side of the rainbow. This is your host, Robert Wallace, and this is a Gays Against Groomers production. Today we have acclaimed author and psychiatrist, Dr. Miriam Grossman, MD, with us, and she's the author of a new book that's out right now called Lost in Trans Nation, a child psychiatrist guide out of the madness. This book was sent to me by my friend Allison Hudson for my birthday this year, which I'm very grateful for. And I'm very grateful that Miriam could appear here with us. So how are you doing today, Miriam?
Doing great. Very happy to be with you. It's really an honor. I really think highly of your organization.
Oh, we appreciate that. And we think very highly of you and the work that you're doing on the front lines to hopefully curb this trend of child transitioning. And that's really what you delve into very astutely and concisely in this book. It's a very fun read. So would you give us a little bit of your background as a psychiatrist, how you began to see the rising of this issue, and we'll go from there.
Wow. Well, this has been going on, this meaning the infiltration of gender ideology, the gender crusade, as I like to call it, has been going on much longer than most people think. It was much quieter, but it was definitely still there. And I discovered it in 2008 when I was researching sex education. At the time, I was a psychiatrist at UCLA for UCLA students. And so many of my patients there had sexually transmitted infections that I decided to take a look at what kids are actually told about sexual health. And so I took a deep dive into that, and I studied different curricula, what Planned Parenthood puts out, what other organizations put out, what's being taught online, what's taught in schools. And what I found is a whole other discussion. And I wrote another book about that called You're Teaching My Child What? And that's a book that's entirely about sex education. But in the middle of that research, I discovered that as part of sex education, kids were being led to believe that that the male-female binary is a falsehood, that it's not true, that it is oppressive, and that it was invented by straight white European men, and that everyone needs to join the struggle against this idea that humanity is divided into male or female. And so that alarmed me. As a doctor, well, you don't need to be a doctor to understand that humanity is indeed divided into male and female. And it alarmed me that even young kids were being indoctrinated. And the reason why I use the word indoctrination is because these ideas were presented as facts that really you could not question. And kids were led to believe that if you don't believe these ideas, you're essentially a bad person. You're a transphobe. You're you're biased. You're not a good person. And so that's why I call it indoctrination, because these are ideas that were emphasized over and over and over again without a chance to question them. So I was concerned that young kids, many of whom already have mental health issues, are being presented with this idea that they may not actually be what their body is, that they may have an identity called a gender identity, which is at odds with their biological reality, and that is a normal condition. That's just a normal variant of human development, and that if you happen to be one of those people who has a gender identity at odds with their physical reality, well, you should know that your gender identity overrides the physical reality, and that you have the option of moving forward, of changing your body in order to match, quote unquote, or to affirm your feelings. So I discovered all that back in 2008, just to get back to your question. And I wrote a chapter in that book that I mentioned, You're Teaching My Child What? I wrote a chapter about gender ideology, and I predicted that this is going to be catastrophic for our children. And, Robert, it gives me no pleasure to say that I was right, and that as time went on, this has become a catastrophe, not only for children, teenagers, and adults, but for their loved ones, for their families. And one of the things that I emphasize in the book, my newest book, Lost in Transnation, is what this whole thing does to families, to parents, and the hell that parents go through, which is also something that people do not have sufficient awareness of.
Thank you for that background. And you were so right in your assessment of what this was really going to become. It's amazing that the indoctrination of such a subtle idea like there's no binary, that it could be so destructive, and it could spin off into all of these crazy things we're dealing with, pronouns, and then right into let's put you on puberty blockers, hormone replacement therapy, and gender reassignment surgery. What do you think, as far as the results of that indoctrination, is probably the beginning elements or the worst elements of the destruction of this next generation in terms of the collateral damage or effects of those ideas?
Well, there's a lot of damage. Let's just start with the damage that's done when a child or an adolescent or young adult who has other mental health issues, which most of them do have. So many are on the autism spectrum. They have anxiety, depression, self-harming behaviors. They may have been through trauma. They may have been molested or abused. They have family issues. And when they come into a gender therapist or a gender doctor and announce that they are the opposite sex, and I'll just say for convenience, we all know, your audience is aware that there's many other options beyond just saying you're the opposite sex. There's all these non-binary and so on and so forth. But just for convenience sake, I'm going to say the opposite sex. So when a young person presents, in the office of a gender therapist or a gender medical professional and declares their new identity, according to gender-affirming care, which is the prevailing model that is used in this country and in Canada with young people, professionals such as myself are not supposed to question that new identity in any way. We are supposed to rubber stamp it immediately and simply ask, what pronouns, what name do you want me to use? And then to go ahead and go with whatever the child is asking of us. And so we are not supposed to do what a therapist or a doctor would normally do under any other circumstances, which is to probe and ask questions and, wonder what's behind this, what could have led to this, get to know the child, because after all, even social affirmation, using a new name, pronouns, and allowing a young person to use the restroom and changing rooms of the opposite sex, that in itself puts them on a path toward harm. We know now that even something as benign, well, we know that it's not benign, but it's presented to us, social transitioning is presented to us as a kindness to the child, as a sign of respect, as a sign of like letting them know that we trust that you know who you really are, and we're not going to stand in the way of that. We love you however you present yourself. Now, of course, parents love their child under any circumstance. That does not mean that we want to go ahead and indulge what I'm going to call is a delusion. And many people won't go as far as that in my profession. They won't go as far as calling it a delusion, but I do that because a delusion is defined as a fixed false idea. So you can have the delusion that you are Madonna or you are Jesus Christ, and it's fixed, and it's a false idea, and you cannot be convinced that you're not those people. That's called a delusion. And I submit that it is a delusion. And now these kids are 100% physically healthy. I am not talking here about people with disorders of sexual development or intersex. That's a whole other issue. And of course, with the Olympics, that's all like blown up and people are talking a lot about that. But just for the purposes of our discussion today, I am speaking about kids who are 100% physically healthy. They have normal chromosomes, they have normal reproductive systems, they have normal hormones. And for them to come out and declare and to be convinced that they are the opposite sex and not their physical reality, I will call that a delusion. So you asked me about the harms. So one of the harms is that because we are not supposed to explore other aspects of the child's life which may be connected and have a causal relationship with the new identity, those things can be dismissed and go untreated. And that's what we're hearing so often from detransitioners, young people who have gone through medical transition and often had hormones and surgery. And then a few years later, or a few months later, they realized that they made a terrible mistake. They realized that their identity issues were connected to their other mental health problems, and that those mental health problems did not improve with their transitioning to another identity. And often it's the other way around, that their mental health issues get worse. And so one of the harms is that those original mental health issues are go without treatment, without recognition. And this can happen for years and years, that trauma is not addressed, or internal homophobia is not addressed, anxiety and depression, self-hatred, all sorts of issues can go unaddressed until much later. So that's just one of the harms that happens. Now, another harm, of course, we could speak the rest of the day about the harms of puberty blockers, cross-sex hormones, and surgeries. And I spend a lot of time in my book explaining those. And by the way, the book is difficult to read because of the subject material, but it's written for regular moms and dads and whoever, people without a PhD. You don't need, a higher degree of any sort. You don't need a college degree to be able to read my book. And I intentionally wrote it for regular moms and dads and other people that work with children, or really anybody now in our society everyone has to understand what this is about because it's affecting all of us. And it's only going to continue to affect us more and more. Most people, by this time, either have a child who is going through this situation now, or they have a relative, a neighbor, or they know somebody whose relative or child is going through a gender identity crisis. So people must be educated. That is, Robert, really, I think there's a number of really big issues here, but one of them is that people don't have access to the facts that they need in order to make informed decisions. Now, why is that? If you don't mind, I'll go in for just a few minutes about how the professional associations have been captured by this ideology and how this crusade of this dangerous idea that a person's identity can be something other than what their bodies announce, than what their bodies are. In other words, that you can be something that your body is not. That is the foundation of gender ideology. So what happened, and again, I explain this more in the book, is that over the years, there have been activists, very outspoken, aggressive activists who essentially took over the committees or, the small groups within professional organizations such as the American Psychiatric Association, the American Psychological Association, the American Association of Child and Adolescent Psychiatry, American Academy of Child and Adolescent Psychiatry, and many other medical groups. And they succeeded in taking over these committees that were charged with making decisions on these topics and charged with the responsibility of writing policy statements. And so what happened is that these organizations published policy statements and came out with positions about gender affirming care that were based simply on what those activists wished, the agenda that the activists were pushing. There was no referendum, meaning, for example, the American Academy of Pediatrics, 67,000 members, pediatricians essentially, belong to that organization. And they came out in 2018 saying that gender affirming care is the only option. We have to rubber stamp these kids' new identities. We have to, at the earliest possible chance, at the beginning of puberty, the first signs of puberty, give them blockers, puberty blockers, which of course is going to prevent normal development, not only sexual development, but total body, brain, nervous system, cardiovascular system, skeletal system development, preventing normal development. And then most of these kids are put on cross-sex hormones. So the American Academy of Pediatrics came out with this in 2018, and they make it look to the world and to the rest of the pediatricians and families like this is all 67,000 pediatricians who belong to this organization are in agreement. There's a consensus among all these doctors that this is the best way forward for these kids. Now, nothing could be further from the truth. The truth is that there's no consensus. There is a debate, and there was a debate in 2018, and it has only become more charged and more heated. There is a huge debate currently going on, an international debate, and the American Academy of Pediatrics and all these other organizations are not willing to acknowledge the other side of things, to look at there's so much data that speaks against what they have recommended. But because these organizations are no longer trustworthy, and it's painful for me to say that. I mean, I'm a doctor. I was trained to trust my medical organ, the American Medical Association, the American Psychiatric Association. I mean, I was indoctrinated, okay, to believe that if I am seeing a patient and I want to learn more about an issue, how to understand a certain issue, how to treat it, what my options are as a psychiatrist in terms of like different medications and so on. Where do I go? I go to the APA. I go to the American Academy of Child and Adolescent Psychiatry. They're the authorities, and I should have, complete trust in them. Well, I'm sorry to say it's many years now that I have certainly not been able to trust those organizations. And I tell parents that they also cannot trust them. And I tell other doctors to please recognize that your professional organization is no longer what you think it is. Everything is politicized, especially the gender issue. So, the harm is very great because the individuals who go ahead and get gender affirming care, and I'm not saying every single person, but many people, this is a developing story, as they say. We don't know the end of this story. There are tens of thousands of young people in this country that have gone through gender affirming care, which again means that we rubber stamp the medical and mental health professionals, rubber stamp the new identity, and we put them on this path of body modification, irreversible medical and surgical procedures, and that sometimes result in lifelong sterility, the inability to have biological children. So we're talking about very, very big things here, not to mention, the risk of osteoporosis, the risk of cardiovascular disease, heart attacks, blood clots, cancers. There's a long list of very dangerous adverse effects. You see, these kids that are placed on blockers and then almost always following that on cross-sex hormones, I don't know if most people don't understand, Robert, they must take these medications for the rest of their lives. It's not a few months, it's not a few years, it's the rest of their lives. They are forever consumers of pharmaceuticals. And from what I have read, each of these young people will represent, and this is without the surgeries, just paying for the hormones is $1 million in their lifespan. So there's a very, very significant, let's say, monetary earnings. Let's put it that way. It's a pot of gold at the end of a rainbow. Sorry to put it that way, but it really is a pot of gold. And you have to also consider, aside from the very expensive surgeries, that because so many of these young people are going to be infertile, and I can explain for you in a minute why they're infertile, how that happens. They will, many of them at a certain point in their 20s or 30s, realize that, it would be nice to have a biological child, or to have, not biological, but to have a child, period. And they will therefore get into, using surrogacy and donor eggs and donor sperm. And that also is going to be, a pot of gold for the biotech, reproductive technology industry. So that's the money part of it. But you asked a few minutes ago about the way that this is destructive. And I've mentioned a few things. What I haven't mentioned, though, is the element of betrayal that parents feel and that detransitioners feel about the medical system, the mental health system. They feel utterly betrayed. They feel that they were misled. They were lied to. They feel betrayed by their political party. They feel betrayed by Planned Parenthood. They feel betrayed by lots of LGBT organizations. And trust me, it's a profoundly disturbing feeling of massive betrayal by people that you trusted and organizations that you trusted.
Wow. Thank you for deep diving in on all of that. And to your last point, I completely agree from, all conversations that I've had with detransitioners or parents of children who've gone through that process. The feelings of betrayal are immeasurable, and it is heartbreaking to see that somebody could be deceived or allowed to go down into that direction without being filled in on really hardly any of the details, the lifelong need for these medicines, the irreversible nature of these things, how it's going to affect your ability to procreate, the fact that you one day might want to procreate and don't even realize it. How do you feel, and something that you kind of mentioned earlier, as far as how the major psychiatric and psychological and doctoral boards, how at those levels they have been infiltrated with this ideology, and therefore everybody kind of under them has been forced into this.
Yeah.
Do you see it as, in a way, like doctors are now being weaponized? Like, here, let me put this idea into a kid's head, and then he goes to a doctor who has no other choice but to put their fingers on the trigger and help them pull the trigger because they can't stop them, and all they can do is affirm.
Well, let me just make a comment about what you said a second ago. In terms of, you mentioned, not giving the kids and their parents all the information. I mean, I'm sure that it's mentioned. Well, I certainly hope so, that, once kids go on these hormones, they're going to have to take them the rest of their lives, that, that their fertility is going to be compromised or just completely non-existent. The question is consent. Is there really an ability for these kids, some of them can be 11, 12 years old, to provide informed consent about something like fertility, about something like, you're never going to have an orgasm. Well, they don't know what they're never going to have. How can they possibly? And anyway, when you're 11, 12, 15, and even I would argue 20 years old, and you want something so badly that you have been indoctrinated to believe that this is truly who you are and that you will never be happy if you do not do these, if you don't alter your body, that you will never be happy. And so there's an element of despair that, unless I get these procedures and these medications, I am never going to be happy with myself. I'm always going to be miserable. In addition, the parents who often sign on the dotted line are being told, your child, if you do not consent to these interventions, could commit suicide. Okay. And which is a myth, which is not supported by the evidence. But so many parents who have come to me, and it's a well-known thing, that gender doctors, gender therapists will say, do you want a dead daughter or a live son? And, I don't know if you're a parent, but, almost every parent is going to do anything in their power to save the life of their child if they're truly convinced that, blocking puberty and then giving your child cross-sex hormones and then, removing breasts and removing genitals, etc., is going to give them their only chance of a happy life. Well, then, yeah, I mean, you might really sign those papers, of course. So, we're not going to have time to go in. These are complex issues. There's certain things in this whole discussion that are not complex. For example, that humanity is divided into male and female, and that you are who your body says you are. Otherwise, you're believing in something like a gendered soul or some sort of religious system that says there's something apart from the body that is more you than your body is, and all that kind of stuff. But the issue of informed consent, that's the issue of suicide, and the issue, the other mental health issues. These are complicated. That's why we recently, there's a report that recently came out that you probably heard of, the Cass report, the Cass review from England. Hilary Cass, a very prominent pediatrician in the United Kingdom, and the National Health Service of the United Kingdom asked Hilary Cass to review all the evidence on the treatment of gender dysphoria in young people. And she undertook this very, we don't have anything like this in the history of gender medicine. It took her and her team 4 years. And they wrote something like a 400-page document reviewing hundreds and hundreds of papers and guidelines and interviewing hundreds and hundreds of people. Anyway, her conclusion was that medical and surgical they didn't even look at, because in the UK you can't do the surgeries on under 18s. In this country we do. We most definitely are doing surgeries on under 18-year-old kids. But anyway, back to the Cass report. The Cass report, in no uncertain terms, said that the evidence in this area is threadbare, and that there is no long-term evidence of benefit for medical interventions in minors, but there is evidence of serious harm. And that is why in Britain and in a number of other countries, which it seems every month there's another country that's joining the list, they are no longer providing blockers and opposite sex hormones to minors unless they are in a study, a controlled clinical study, which will have very, very strict criteria for entering. It will, follow the kids and their families very closely, will provide psychotherapy, but essentially almost, most of the population will not have access to these interventions. And this follows in the footsteps of Sweden, Norway, Finland, and other countries. So we here in the US and Canada, where in some states kids can walk into a Planned Parenthood and other clinics at the age of 15 or 16 or 17, and even without parental consent, get these medical interventions, we are outliers. And the evidence is overwhelming that this is not what we should be doing. This is not good medicine, and people are going to pay a heavy price.
Absolutely. And they are. One of the reason why I had actually mentioned in that that last question, as far as people not really being informed, is, well, I believe you're correct. I mean, you can't not sign a document that doesn't have endless disclosures attached to it. Is that for so many of the detransitioners that I personally spoke with, they found themselves or felt themselves to be underinformed or uninformed about these things, the true consequences. So the details swept under the rug, or whatever the case may be. And to your point again, they're completely incapable of giving informed consent. One, because you can't consent to something that's not possible. It's not possible to change your gender, merely the appearance of your gender. So they're already misled there. And not to mention, they don't even, as children in particular, understand the consequences of what they're doing. They're going to feel different.
Especially the fertility and the sexual dysfunction. But let me get now to, you asked me about the medical organizations and the doctors being weaponized. People should be aware that there's incredible intimidation that goes on. I've certainly experienced it. And, it's like with any other politicized issue, there's this, this position that is basically, any decent human being is going to believe X, Y, and Z. And if you don't believe X, Y, and Z, or you question it, that means you're not a good person. And that means that, you're a whole long list names you could be called. And then you're just dismissed out of hand without getting into the substance of the argument and the real without getting into the real discussion of the topic. You're dismissed and you are marginalized or completely, gaslit. So this is what goes on. And almost every day, Robert, I have to say, I get an email or a DM on my X account from, which by the way is Miriam _Grossman, from a doctor, a therapist, a teacher who thanks me profusely for my work and says, I can't speak up. I would lose my job. I can't speak up, including surgeons who have contacted me and are outraged at what's going on, the bilateral mastectomies that are being done on girls as young as 12 years old in this country. And genital surgeries are also being done on minors. So there are many doctors who would like to speak out, and there are actually, it's not that I'm far from the only person that's spoken out. There's many, many doctors who have, not enough. There's an organization that I'd like your listeners to look into called do no harm medicine.org. Full disclosure, I'm a senior fellow there. That's a fabulous organization to join, to become a member, to follow them. They're doing incredible stuff. So, there are cracks in the edifice. More and more people are speaking up, doctors, teachers, and parents, detransitioners. So it is happening. There are more and more lawsuits also of detransitioners against doctors and therapists. But at the same time, people should understand that there is intimidation in the medical profession. I spoke to a resident, a young woman who is in training to be a pediatrician, and she is training in a Midwest, deeply red state. But in her training program in the hospital where she's working now, she told me that if there's a child that comes in there with gender dysphoria and she goes in to speak with the parents of this child, and she's accompanied by the attending, meaning the doctor who's on the staff of the hospital, whereas she's just in training, right? She's a resident. She's with the attending who is her superior. She cannot say a peep about essentially, what the truth is on this issue, because the attending is so completely, a proponent of gender affirming care and is speaking to the parents only about gender affirming care being the only option, and threatening, presenting to the parents that your child may commit suicide and so on and so forth. And this young doctor told me how she has to sit there and just bite her tongue and how difficult it is, because she knows she would be in big trouble if she said anything contrary to what the attending pediatrician was telling the parents. So there is very significant intimidation, and people are afraid of losing their jobs, losing their licenses, and not being able to practice medicine.
That really touches on a question that I've had for some time, because we see doctors of all different disciplines come out and they speak against the establishment. They speak against what is taken to be established medical knowledge. And then they find themselves at some point at risk of losing their license or being penalized in some way. And so I kind of, it makes me wonder, what is the threshold for a trained, licensed professional, for instance, like yourself, to say, look, I'm going to speak out from my expertise, from my own findings, and I'm going to say things that are not codified or taught by the establishment. How far can you go before they really do start taking your license?
Well, I know that, in my case, because I don't affirm my patients in their new identities, and because I try to help young people to return to a sense of comfort with their bodies and a sense of acceptance and comfort with who they are, while at the same time acknowledging that there is no one way to be a girl and there is no one way to be a boy. And there's a spectrum of personalities, not a spectrum of sex, but there's a spectrum of personalities. And you can have more masculine girls, obviously, and more stereotypically feminine boys. We just don't want to damage the body. You want to be able to express yourself in whatever way, but leave the body alone. So because that is my message, I could theoretically, be investigated by my medical board for practicing what is called conversion therapy. Now, conversion therapy, as you probably know, and many of your listeners, it was a term that originally was used to refer to therapy whose purpose was to help people who were unhappy with their sexual orientation. Sexual orientation is different than gender identity. Sexual orientation refers to who a person is romantically attracted to. Gender identity is how a person identifies as male or female. So they're two very, very different things. But conversion therapy was, like I said, the name given to therapy whose purpose was to help individuals who would come in and say, I am a woman, for example, say, I'm attracted to other women romantically. I'm not comfortable with that. Help me. It's against my religion, so on and so on. And so there were therapists, and there still are therapists that will do that. Will try and delve into that issue. And we're not gonna get into that right now. It's separate from our discussion. But what happened is that along the way, instead of limiting conversion, and conversion therapy, by the way, has been outlawed in about 20 states, I believe. So what happened is that gender identity, trying to change a person's gender identity, your patient's gender identity, was added to the definition of conversion therapy. So that conversion therapy, as defined now, does not only mean when a therapist tries to help someone in their struggle against their sexual orientation, but it includes the kind of work that I would say I do, which would be to help a person accept the physical reality of their bodies, to come to terms with it, to find ways of expressing themselves that feel right, that feel authentic, while leaving the body alone. So that could be construed as conversion therapy, and I could theoretically be investigated for that. It's not happened, thank God. I only know of one case, actually, I think in the entire country, of a therapist who's been investigated for that when it came to a gender patient, but still it sort of hangs over your head. But maybe more importantly is that it can become very difficult to keep your job or to get a job if you are, very openly speaking out and giving your opinion and, saying things like, a male cannot become a female, a trans woman is not a woman, sex is not assigned at birth, all these things. You're risking, somewhat depending on where you live, but even in deep, deep blue, red, conservative states, because the professional organizations have been so hijacked, and because there's so much pressure to go along with this fake consensus. There is no consensus, but there's a pressure to just go along with, which is terrifying, because that's a tyranny, not being able to speak up and object. Now, I think that things certainly are getting better. Things are better even than they were a year ago. The Cass report has kind of changed the game to a certain degree. You know, we now have this unbelievable 400-page document. Like I said, there has never been anything like it. And, you know, that's not something that can be ignored. The medical organizations, some of them are trying to ignore it and trying to downplay it and to say that it's not legitimate and to, you know, undermine its legitimacy. But we'll have to fight it out. I think that things are going in the right direction. I'm much more optimistic than I was a year ago, but there's going to be a lot of victims of this ideology. And I'm pleading, I'm really begging with families and really everyone to read my book. Go to my website, miriamgrossmanmd.com. There's a lot of videos on there. You can see my testimony to Congress. It's only 5 minutes long, but it's reached millions of people. I also have a wonderful interview with Jordan Peterson, in which I speak primarily about the parents, the damage to families and parents, and how they've been ignored by the mental health profession, more than ignored, demonized by the mental health profession. And so there's a lot to read. And I'm begging people to please get educated, learn as much as you can, because even if you don't think this is going to impact your life, I guarantee you that it will in some way.
Amen to that. It is so true. So many people don't even believe this is a real issue until one day little Johnny is coming home and he's feeling like a little Sally. And now you've got to go deep diving and you got to figure out what you've been ignoring all these years. Yes, Jordan Peterson wrote the foreword for your book, Lost in Transnation. He's also a genius. And so that's great that you guys were able to collaborate on that. And a lot of what you just said kind of goes into my next question, which is, do you see the tide turning? Are more people becoming aware what's happening?
You know, I hope so. The thing is, I'm kind of in a bubble because this is what I do all the time. So I'm just always reading and talking and discussing this with other people who are, so to speak, in the bubble. But I do hope that it becomes a big issue in the election, because we really have a majority in terms of whether, you know, you're Democrat, Republican, independent, whatever you are. We do have a majority in this country of people who do not feel that minors should be given these irreversible medical and surgical interventions. And I really do hope that it becomes, and I keep waiting, like at one of the debates, for this issue to be brought up, but you know, I'm still waiting. I don't think it's been brought up in any debate yet. This is one of the major issues facing our country. I mean, we have a lot of big issues, but this is one of them, because the proponents of this ideology will not stop. They are just keeping going. I mean, it's not going to stop with bathrooms, obviously. It's not going to stop with sports. It's not going to stop with it. I mean, it's just not going to stop, because that's the nature of this whole way of thinking. It's to always be pushing the envelope, and to always, for example, the World Professional Association of Transgender Health, WPATH, which is behind a lot of what we've been talking about here in terms of advocating for sex reassignment in youth. In their latest standards of care, they have a chapter, believe it or not. Do you know about this, Robert? They have a chapter on eunuchs. A eunuch is a boy or young man who's been castrated so that not a young man. It's a boy who was never given the opportunity to develop into a young man. And he's castrated, so he'll never be exposed to testosterone. He will never develop the voice or the body of a young man. He will never be able to reproduce. And they're calling it a sexual orientation. And they are proposing that eunuchs, that boys can be castrated at a young age, and that this is simply another another option, another identity for a young person to be a unit. So what I'm trying to say, and there's so much more that we could talk about, but that it's not going to end with, we kind of always feel like, okay, let's give this out of respect and kindness. And, it seems sensible. It seems okay. So let's give in on this issue. But you wake up the next morning and it's something else. And there's going to be just more and more. And that's what people need to be aware of. And we need to end this, and we need to follow in the footsteps of these European and Scandinavian countries who have done the right thing, and they're protecting their young people.
Absolutely. If anything, I had actually a period in my life where I wanted to be a eunuch for many years. And so luckily, my mother talked me out of that when she told me, hey, wait a year, even though I'd spent years wanting to do this. And by the end of that year, and I was so certain because every day I was like, still want to do it. I got to a book called Think and Grow Rich by Napoleon Hill. And in one of the last chapters called Sex Transmutation, I was reading it and I had this revelation about what the effects of actually doing that, this is post-puberty also, by the way, but what the effects would have had on me and my ability, my drive, not just my competitive edge, but just to progress in life and all the things that would have been negatively affected as a result of going down that route. So, it's interesting now to hear that word kind of coming back up. We see it in biblical terms or whatever also, but we can't trust anything really coming from WPATH. And so thanks to Mia Hughes, her report.
That's really incredible. I hope that I think it would be massively important for you to tell your story. I mean, maybe you haven't, I'm not aware.
I haven't really, just anecdotally in a few interviews. So yeah, maybe at some point I should put down the logic and how I was operating from that place. I identified also as asexual as well. So that seemed to, and it really, I think, came out of a lot of internalized homophobia and shame and self-repression, because I did not want really to be affiliated or associated with any sexuality. And so that seemed like
I am so happy that you were saved from that and that you didn't go through with that.
Well, I appreciate that. Thank you so much, Miriam. Well, we have a few minutes left. This has really been an amazing conversation. I love that you are senior fellow of DoNoHarmMedicine.org. We all know the Hippocratic Oath, to do no harm. And unfortunately, people are forgetting that because they're being indoctrinated top down that this is not harm to remove healthy body parts from children. What else would you like to, or rather, where else would you like to direct people to find you and what you're associated with?
Okay, well, I guess the only other thing I didn't really get to say was that in my book, I have a lot of very practical advice for parents, both parents who have a child who is confused about who they are, and parents whose kids, are fine, but this may happen at some point in the future, and you want to be educated and prepared. So, for example, I have one chapter has a model conversation between a parent and a child who has just come out and said, "I'm not a girl, I'm a boy." So, what do you do? How do you respond? What do you say? And so I have this model conversation. I have a model conversation between a parent and a gender doctor or a gender therapist. It could also apply to a conversation that you might have at a school with people who are uninformed and they believe that your child, truly should be affirmed and transitioned. And it gives, people don't have the words, they don't have the arguments. And so I'm supplying people with those arguments and those words and the ideas that they need to present, convincing ideas. And then I also have a bunch of appendices in the back about dealing with schools, child protective services, if it comes to that, because we know that in some places, child protective services has actually removed children from the family if the family will not go along with the new name and pronouns. So how to deal with that, and very, very importantly, how to get control of your kids' internet use. And this is just, I can't overestimate how important this is. Many, many kids are being indoctrinated by groomers online, gays against groomers, right? Or even if they're not groomers, they're simply going to websites or YouTube or whatever it is, and they are watching and learning material that is going to indoctrinate them. So it's very, very dangerous, and parents have to be in control of their kids' internet use and know who they're talking to out there. So essentially, it really is a guide. I'm very proud of it. I wrote it with my blood and guts. So the ways to reach me on X is Miriam_Grossman. My website, MiriamGrossmanMD.com. Again, the organization DoNoHarmMedicine.org. And keep learning and be courageous and tell your child the truth.
Absolutely. Well, fantastic. Again, the name of your book is Lost in Translation, A Child Psychiatrist's Guide Out of the Madness. Got to pick it up. Those model conversations you mentioned were so smooth and expertly done. You can see how effective somebody with that dialogue in hand would be in the face of the kind of pushback that you would end up getting. So,
and it might also come to think of it. I mean, it's not just a parent; it could be an aunt or uncle or grandparent. Whose family member comes to them and say, from now on, I don't want to be Jack, I want to be Sally. So it's really a conversation that goes beyond just the parents. So, also, the last thing I'll say, for people who don't want to read a 300-page book, which I can understand, I did the narration for the audio version. So you can get the audio version on Amazon and listen to me reading the book. Now, be careful because there's like 6 or 8 fake workbooks that people have put on Amazon. They're called like a workbook for Lost in Translation, Dr. Grossman's book. There is no workbook. That is a scam. Do not buy the workbooks.
Excellent. Thanks for pointing that out. Go right to the source, get the official bona fide information straight from Dr. Grossman. I love it. Well, that's all the time we have. So everybody go and visit Dr. Grossman. And for that matter, if you want to get in touch with Gays Against Groomers regarding this podcast or any guest suggestions, anything like that, go to gaysagainstgroomers.com. You can email podcast@gaysagainstgroomers.com. And you can find us on X and Instagram. Just look up Gays Against Groomers. It's @Against Groomers. Against is spelled funny on there. And you can see every day we're posting the evidence for these things that you're being told by others. It's not happening. It's definitely happening. And so until next week, this is Robert Wallace, and have a great week.